Okay, I performed hand hygiene and have applied gloves in order to prevent infection. I'm now going to introduce myself to my patient and let him know what we're doing today and ask if it's okay. All right, my name's Carolyn. I'll be your nurse today. We are going to do a physical assessment if that's okay.
That's fine with me.
Okay. Can you state your name and date of birth?
My name is Cody Reed. Date of birth is 8/21/93.
Okay, and how are you feeling today?
I'm feeling okay.
Okay, and what year is it?
It is 2023.
Where are you at?
I am in my apartment.
Okay, and what are we doing right now?
We are doing a physical assessment.
Okay, so he's alert and oriented to self, time, place, and situation. He has a pretty good mood going on. He appears well in appearance, well dressed. Okay, so I will be doing an overview of your skin as we go along, but for starters, I actually want to check and see about your nails, if that's okay.
Sure.
All right, so I'm gonna check bilaterally. We have a less than 3 cap refill. I do not see any clubbing. It's less than 160 degrees. The end of the fingertips. They're pink. They're well trimmed. And we've got good cap refill. And let's see. All right, so now I'm gonna check your head and neck. So we'll start off with your skull in general, just your head in general. Looks normocephalic. We've got thick black hair. It's coarse in nature. Moist for the scalp. We do have a slight receding hairline. And the hair is evenly distributed besides that receding hairline. Okay. All right, so your nose is midline. And whenever I look at it, and I look up into it, the nares are patent. The septum is midline. Don't see any deviation. Okay. So we're gonna look at your eyes next, okay? All right, so I'm gonna shine a light. I want you to look at me. I'm gonna shine a light to the side. Okay. We got Perla. So we have pupils are equal, reacted to light. Okay, I want you to look at the tip of this pin and then look at the wall behind me. Okay, and accommodating. They're equal, reacted to light, accommodating. Okay. All right, the eyebrows. They look like the hair is evenly distributed. Okay, your lips. They're even, moist. Okay. Your ears. We have elasticity. Okay. And now we're going to look at your face in general. We're going to look at the elasticity on this side as well. Okay. Both ears, elastic, good to go. The face is symmetrical. No droop or anything. Can you smile for me? Okay, good, good. We have some facial hair. I don't see any lesions. The skin looks nice and smooth. We got a little bit of dry skin right there, but that's okay. Don't have any other areas of concern. All right. And then we've got, oh, open up your mouth. Okay, I'm gonna check back here. Uvula is midline. We have a soft and hard palate, looks good. The tongue is coarse on top, but it's moist, looks rough. Lift up your tongue, please. We have lots of vessels and it's nice and shiny. Okay, the teeth, we have some fillings in, but they all look intact. Okay. All right. Oh yeah, and for your eyes, we have slightly red sclera since you do have contacts in, and you're new to that. And then we just have the eyelashes are evenly distributed. If I was to use a ophthalmoscope, we would be looking at the optic disc, macula, and vessels of the back of the eye. Otherwise, we just look at the front of what we can see. Your conjunctiva are pink. Don't have any signs of infection or anything, no drainage, nothing like that. Slight circles under the eyes, but that's okay. It means you're a little tired. All right. So then we have, oh yeah, and you don't have any parasites or anything on the scalp, nice and clean. All right, so we have your neck. So I want to palpate your carotid arteries. I'm gonna do one at a time.
Okay.
Okay. Okay, and then I'm gonna use the bell of my stethoscope to listen. Hold your breath. Okay, I don't hear any bruise, nothing abnormal. All right, so I'm gonna feel for your sinuses now. We have any tenderness?
Nope.
Okay. All right, now I'm gonna check your lymph nodes. So I have your periauricle, which are in the front here. And what I want to do is I want to feel that they're movable and not swollen.
Mm-hmm.
Okay. And then we have your posterior auricular, which are behind the ears.
Mm-hmm.
We have your tonsillar, which is go here. Occipital, just toward the back a little bit. Superficial cervical, posterior cervical, supraventricular, submandibular, submental, and submandibular. Okay. All feel good. I don't feel any swelling or anything noted. All right, so your eyes are the top 1/3 of your face. Your mouth is the bottom 1/3. Everything looks even. No issues there. Nose is midline, septum midline. All right. So with your ears, I'm going to assess those a little bit better. I'm going to look inside, and I'm looking to see if you have any cerumen. We have a little bit. Nice and golden. See them on this side. Okay. Any tenderness?
Nope.
Okay. No tenderness. All right, so for your thorax, all right, I'm gonna check and see if you have how your turgor is. So we're gonna feel your clavicle.
Yeah.
Okay, good skin turgor, nice and elastic. All right. So I'm gonna feel and see if you have any tenderness or fremitus, which would be any crackling underneath the skin. Okay. if you wouldn't mind taking your shirt off for a moment. Okay, let me see your spine. Turn you to this. Okay, the spine is S-shaped. It is midline. We have a anterior posterior to transverse diameter of 1 to 2. Okay. All right, I'm just gonna feel and make sure there's nothing back here. All right, so now I'm gonna start listening to your lung sounds. So you're gonna breathe a little bit deeper than what you normally would, okay? And I'm gonna check in 10 spots on your back and 10 spots on the front and 2 on each side.
Okay.
So we'll start back here. Listen to the side here. Okay, turn. All right. Lung sounds were clear to auscultation. I didn't hear any adventitious lung sounds. Air is freely moving. All right. So now I'm going to percuss and make sure that we don't have any issues. Okay, and didn't feel anything abnormal. I'm checking to see if you have any any lumps, any spots of concern whenever I feel, and make sure that you have free air moving where it needs to. All right, so for your cardiovascular assessment, I'm going to point out each area of the heart that I'm going to be looking at. So we have the aortic, second intercostal space and right sternal border, which is going to be right here. We have this pulmonic, which is the second intercostal space, left sternal border, right here. All right. And we have Erb's point, which is the third intercostal space, left sternal border. And then we have the tricuspid, which is actually either the fourth or fifth intercostal space with the left sternal border. And then we have the mitral, which is the fifth intercostal space, mid-clavicular line. So we would go down right there. So I'm going to check each one of these points and make sure that there's no abnormal heart sounds. I'm going to listen for S1 and S2.
Okay.
Okay. I'm going to auscultate for the apical pulse, which I can feel. It is not bounding though. So now I'm going to check your apical pulse by listening to it for a whole minute. Okay, I got 92. A couple more up from whenever we took your vitals earlier, but I have had you move around a little bit. All right. Now I would like to assess your abdomen.
You down for this?
Mm-hmm. Yes. Oh, yes. Lay down for me, please. Oh, yeah. And your rhythm was regular. I didn't hear any abnormal heart sounds. All right. So for your abdomen, so we specifically do this in a particular order where we inspect, we auscultate, then we palpate and percuss, because we don't want to upset the stomach. Well, it'd be percuss and then palpate, because we don't want to upset the stomach and make it to where it sounds crazy to us. All right, so looking at you, umbilicus is midline. There is hair that's evenly distributed across the abdomen. Okay. So I see a couple of spots that we might assess for symmetry, color, any issues, and we might actually send you to a dermatologist for it's just a couple of moles that you have. All right, so now I'm going to auscultate. We're going to start in your right lower quadrant. would actually listen to each area and make sure that you have between 5 and 30 vowel sounds each time, but they are active, normal active actually, and I don't see any problems there. All right, so now I'm gonna feel and see if you have any tenderness. Any tenderness?
Nope. No tenderness.
Okay. Alright. So no tenderness. Abdomen is kind of round. No distension. Okay. So now I'm going to check your vascular system, peripheral vascular. I'm going to look at your arms. I don't see any lesions, any issues with the skin there that I need to be concerned about. I've already checked your cap refill on your fingers, and your nails are translucent if I didn't mention that. Okay, so pulses. We'll go ahead and do the brachial pulse, and I do check both of these bilaterally. Even and +2. We're going to check your radial. Even and +2. All right. Now I'm going to move this down to where I can see your legs really good. And I'm going to assess to see if you have any edema, any problems. The hair looks evenly distributed. You do have an area down here where it looks like you've worn socks a lot to where you don't have as much hair. I don't see any lesions, any points of concern. No edema. Okay, I'm going to take off your socks. I'm going to check your cap refill on your toes. There's a couple of fungal nails. We do have less than 3 on each one. They are translucent except for the fungal nails, and they are trimmed. Okay. And then I'm going to check your posterior tibial pulses. Even +2. And your dorsalis pedi. Even +2. Okay. Alrighty, so the main organs in the abdomen that we were looking at, we have the liver and the gallbladder in the right upper quadrant. We have the large intestines and spleen in the lower right quadrant. We have the small intestines in the lower left quadrant. We have the stomach. The stomach and pancreas are in the upper left quadrant. Okay. Alrighty. I don't believe I went over the otoscope. So whenever you look at the otoscope, you're looking for the eardrum and making sure that it's pearly. Making sure that there's not a buildup of cerumen and that there isn't any issue with the eardrum being busted. You'd look for any signs of that, any irritation or anything. Okay, I think that concludes the entire assessment.
All right.
Thank you very much.